Hello everybody, I'm Stephanie and I would like to discuss about liver and biliary apparatus. So let's start with liver. The liver is the largest organ in the body. It is a gland, so it is the largest gland in the body. It weighs about 1.5 kilogram. Some said in range of 1.5 to 1.8 kilogram. So it is pyramidal in shape. It is kept in the thin, soft glycan capsule. It lies under the diaphragm and it lies in right hypochondrium and epigastrium. It is very large, so it occupies 2 of the 9 regions of the abdomen. You can see the surface marking of liver in yourself. The upper marking is the xiphi-sternal joint and it slightly curves toward the left. It's about 7 to 8 centimeter from the midline towards the left, and to the right it curves upward to reach the level of right nipple, and then to the right border is mid-axillary line from 7 to 11 ribs. There are two surfaces in the liver, the diaphragmatic surface and visceral surface. The diaphragmatic surface is covered by peritoneum except the bare area. You can see the bare area in the picture below. So the visceral surface is seen when the liver is flipped to the right or flipped upward, and the above picture is the liver flipped to the right. So there is there is obviously the H-shaped group of fissures and fossa. You can see the blue inferior vena cava and green gall bladder in the right sagittal limb, and in the left sagittal limb there are ligamentum venosum and the ligamentum teres. So you can remember V for V. Beside inferior vena cava is the ligamentum venosum. And the porta hepatis is the middle of the H. It is the deep transverse fissure which is 5 cm long, and it contains portal vein, hepatic artery and hepatic ducts, and also the nerve plexuses and the lymphatic. So this is the porta hepatis. It contains portal vein, hepatic duct and the hepatic artery. There are ligaments that hang the liver in place. They are falciform ligament, coronary ligament, and the two triangular ligaments. This is falciform ligament hang the liver to the diaphragm and supraumbilical anterior abdominal wall, and it contains the ligamentum teres and the paraumbilical vein. And the coronary ligament in the middle, and left triangular ligament and right triangular ligament. You can see the middle part is the middle vertical ligament is the falciform ligament, and the coronary ligament, calf coronary ligament, and the left triangular ligament on the left. You can see a big right triangular ligament in the back of the liver, and on the right side it is the right triangular ligament. On the left side it is the left triangular ligament. In the middle you can see a teal-like caudate lobe. So we see the liver from above in this picture, and we can see the left triangular ligament that marked with ball pen. The blue circle is the inferior vena cava, and right of the blue circle is the coronary ligament. The pen is marking right triangular ligament here. This is the back of the liver. You can see blue inferior vena cava and green gallbladder and the H. Liver is very large, so it is divided into lobes. It is divided anatomically by falciform ligament to left and right lobe. Left lobe is smaller and right lobe is bigger anatomically. In the back, there are tail-like caudate lobe and quadrangular quadrate lobe. These are the anatomical lobes of the liver. The functional right and left lobe is divided by Cantley line, a line extending from inferior vena cava posteriorly to the gallbladder bed anteriorly. And this is from back, cantilined apart, right and left functional lobes. Coil segments are the segments divided on the basics of blood supply and the biliary drainage. There are 8 segments in a liver, and the caudate lobe is segment 1, and segment 2 and 3 are on the left anatomical lobe, and segment 4 is between the falciform ligament and the Cantley line, and segment 5 and 6 are the inferior segments of the right functional lobe, and segment 7 and 8 are the superior segments of right functional lobe. So you can see coil segment 2, 3, 4, 5, 6, 7, and 8. So this is the back of the liver. You can see segment 1 here, and segment 2, 3, 4A, 4B, 5, 6, and 7. Segment 8 is not seen here. Liver gets dual blood supply. Portal vein has been the main supply to the liver. It carries venous blood, and hepatic artery carries oxygenated blood. They both supply the liver. So the aorta gives to the celiac trunk, and the celiac trunk supplies the liver by hepatic artery. And the arterial supply also goes to the spleen and stomach and the intestine. They all give the venous blood to the portal vein, and the portal vein goes to the liver, and the liver gives off the hepatic veins to drain to inferior vena cava. So the venous drainage of liver, it started from the union of the central veins in the hepatic lobules, and they form 3 main hepatic veins, which are right, middle, and left hepatic veins, and they open into the inferior vena cava. So the small collections of the central veins form a network and form the hepatic veins that drain into the inferior vena cava. So sometimes the left and middle hepatic veins joins before going into the inferior vena cava, sometimes not joining. Left, middle, and right separately opens into the inferior vena cava. So you can see the openings of hepatic veins in the inferior vena cava. The lymphatic drainage of the liver and gallbladder goes to the hepatic lymph nodes, sometimes through pyloric lymph nodes or sometimes not going through pyloric lymph nodes to the celiac lymph nodes. The bare area of liver has separate lymphatic drainage to the extraperitoneal lymph nodes and then to the mediastinal lymph nodes. Liver is supplied by the sympathetic nerves, by celiac ganglia, and also the vagal branches. If goes into details, the liver is seen as the hexagonal-shaped hepatic lobules. Each lobule is a hexagonal shape, and each has a central vein in the central and the radiating hepatocytes with the small venous collection, which are sinusoids, in between the hepatocytes. And the classic description is a hepatic lobule. It is pinhead size, hexagonal shape with a central vein, and plates or cords of the hepatocytes separated by vascular spaces of sinusoids. The corners of the lobules are the portal triads, and each portal triad has a small branch of hepatic artery, portal vein, and the bioduct tube. So where did the liver come from? It is the foregut compartment. It comes from foregut. So the foregut gives rise to the septum transversum. The cranial part of the septum transversum becomes the pericardium and the diaphragm, and the caudal part of the septum transversum becomes the ventral mesogastrium, and the Y-shaped diverticulum develops into the liver or the hepatoblast, and it becomes the hepatocytes and the biliary epithelium. Liver is a very large and friable organ which is fixed in position, so it is very easily ruptured and the bleeding may be severe. And the liver receives all the blood from the gastrointestinal tract, so it is the commonest site of infection spread from the GI tract. And when the liver abscess rupture, it may spread upward through the diaphragm to the pleural cavity and the right lung. And when the liver cells are destroyed, it is replaced by fibrous tissue and the disease called cirrhosis of liver develops. Liver is also the common site for the carcinoma metastasis. Sprinkle maneuver is a very useful maneuver in the surgical management of liver. Did you remember both hepatic artery and portal vein are in the same place called portal hepatis? So we can press it there and stop the blood flow to the liver for a few minutes, and then we can operate on the liver. So the next is the biliary apparatus. The extrahepatic biliary tract is composed of 3 hepatic ducts, gall bladder and a cystic duct, and the Bioduck. Now we start with the gall bladder. It is a globular pear-shaped viscous with capacity of 50 ml. It has 3 parts: fundus, body, and the neck. It lies in the gallbladder fossa on the visceral surface of the right lobe of the liver, adjacent to the quadrate lobe. So the gallbladder is a bulbous blind end structure. Its fundus touches the peritoneum of the anterior abdominal wall at the tip of 9th costal cartilage, where the transpyloric plane crosses the right costal margin at the lateral border of the rectus sheath. So the gallbladder is supplied by cystic artery, which is a branch of right hepatic artery. It runs in the Callops triangle. It is formed by liver, common hepatic duct, and the cystic duct. The venous blood in the gallbladder is drained by small veins in the gallbladder bed. It goes into the liver and some into the hepatic veins. And one or more cystic veins may be present, but it is uncommon. And cystic veins do not accompany the cystic artery. The lymphatic drainage of the gallbladder goes to the nodes in the portal hepatic, and then to a cystic node in the Callops triangle, and then to a node in anterior boundary of the epiploic foramen, then to celiac nodes and to the para-aortic nodes. The gallbladder is a fibromuscular sac in its histology, and it has smooth muscle in its wall. And inner mucous membrane is a lax areolar tissue lined with simple columnar epithelium. Because it is a gland, so it contains simple columnar epithelium. It is honeycomb appearance in the body, and it has a spirometer in the neck and cystic duct so that it can contract to close the gallbladder. As for the hepatic ducts and the bile duct, the right and left hepatic duct join to form the common hepatic duct, which is about 4 cm in length. The common hepatic duct lie near the right end of the portal hepatis, and the common hepatic duct and cystic duct combine to form the common bile duct, which is about 6 to 8 cm in length. So you can see the right hepatic duct and the left hepatic duct join to form the common hepatic duct, and it joins with the cystic duct. to form the common bile duct. They goes into the duodenum, the second part of the duodenum. On the left side of the second part of duodenum, common bile duct is joined by the pancreatic duct to form the ampulla vata in the wall of the duodenum. The ampulla vata opens into the duodenum in its posteromedial wall at the summit of the major duodenal papilla, which lies 8 to 10 cm from the pylorus. Uh, the circular muscle around the distal end of the ampulla is thickened to form the sphincter of Oddi. The blood supply of the biliary tract is supplied by small branches from cystic and hepatic arteries, and also the posterior branch of the superior pancreatico-duodenal artery. The small veins from the biliary tract drain into the portal vein or directly to the liver. So the extrahepatic biliary tract has both neurocontrol and hormonal control. Hormonal control is more important by cholecystokinin from the neuroendocrine cells of the upper small intestine, which come out when the food goes into the duodenum. And the neurocontrol is by parasympathetic and sympathetic. Parasympathetic fibers are the vagal fibers, and it contracts the gallbladder and relax the sphincter, so the bile go into the duodenum. The sympathetic fibers inhibit the contraction. The afferent fibers that subserving pain, the pain of the biliary tract or the pain of the gallbladder, mostly run with the right sympathetic fibers, which is T7 to 9. But some may also run in the right phrenic nerve, which has root value of C3 to 5. So the Murphy sign in cholecystitis. Cholecystitis is the inflammation of gallbladder, and when we ask the patient to take in and hold a deep breath while palpating the right subcostal area, pain on inspiration if the gallbladder is inflamed, so the patient catch breath. The biliary tract pain is usually felt in right hypochondrium and epigastrium, and it may radiate round to the infrascapular region, which is also supplied by T7 to 9 spinal nerves. The phrenic nerve supply explains the rapha pain to the right shoulder region, which is also supplied by C3 to 5. Okay, that's all for today. May you all safe. These are the references I use. There are so many anatomy books, but the Natter is one I would like to recommend you. And you can also search YouTube channel simply typing anatomy of liver and biliary tract, and you can see so many videos. This might be helpful to you. Thank you so much for your kind attention.